My name is Chelsea Compare, and today I will be doing a presentation on Bloom syndrome. You may ask, what is Bloom syndrome? Bloom syndrome is an inherited autosomal recessive disorder where there is a mutation in the BLM gene. This BLM gene mutation causes breakages and abnormalities in the chromosomes. Now, for Bloom syndrome to be passed on, both parents have to be carriers of the disease. As you can see right here, you have two parents that are both carriers of the disease but are not affected by the disease. By them both being carriers, they have a 25% chance of having a child that is not affected by the disease at all. They have a 50% chance of having a child that, like them, is a carrier of the disease but are not affected. And then they have a 25% chance of having a child that is affected by the Bloom syndrome. The biggest complication in Bloom syndrome is cancer, lymphomas, and leukemias being the most common cancers. People with Bloom syndrome also experience learning disabilities, and they also have an increased risk for diabetes and COPD. When a patient has Bloom syndrome, they may have a decreased immunity, which leads to more ear infections, more upper respiratory infections, and they also have a greater susceptibility for bacterial infections, so they really have to watch those things. Also, people with Bloom syndrome, males have smaller testes, which causes them to be infertile. And then females go through menopause early in life, and they can also be infertile. So those are the reproductive effects of Bloom syndrome. Signs and symptoms of Bloom syndrome, they are all very short, have a short stature, and this is shown early in life at birth. They have a low birth weight and low birth length. They have a photosensitivity, which is they have reaction and increased sensitivity to sunlight. And because they have small dilated blood vessels in their face and different parts of their body, when they come in contact with the sunlight, they have a very prominent rash that breaks out on their face, across their nose and their cheeks, which it looks like a butterfly shape. Also, people with Bloom syndrome have very high-pitched voices and very distinctive facial features, such as a long, narrow face, big ears, a big nose, and a small lower jaw. Now, to diagnose Bloom syndrome, there are a few tests that you can do. The biggest test that they do is the sister chromatid exchange analysis, which is where they go in, they take a sample of blood, they treat it with certain chemicals, and they look at the chromosomes that are in that sample. And when a patient does have Bloom syndrome, they will have a 10-fold increase rate of the sister chromatid exchange. Another one is they take blood samples and they look at the BLM gene and see if there's any type of mutation for the BLM gene. And this is just for people that they know are carriers of the disease. And if they do know that a patient is a carrier of BLM, if they do have a baby and while they are pregnant, there is prenatal testing that they can do on the infant to test for the mutation in the BLM gene. There is no treatment for Bloom syndrome yet that they have found. The only thing a person with Bloom syndrome can do is to treat the symptoms that they experience, and they can stay out of the sun is the biggest thing that they can do, or limit their exposure to the sun when they are outside. They can wear sunscreen, hats, sunglasses, things like that to limit their exposure to the sun. And also early testing for cancer is recommended for people who may have the chance of having Bloom syndrome. Now, the outcome of Bloom syndrome, people pass away between the ages of 1 and 48 from Bloom syndrome, but the main age that they pass away from is age 23. Patients usually die. The biggest cause of death for people with Bloom syndrome is cancer, which is 80% of those deaths are caused by cancer. And then your respiratory infections are the second leading cause of death. The Ashkenazi Jews is a race or an ethnic group that is pretty much susceptible to having Bloom syndrome. Out of the general population, 1 in every 6,330,000 people are affected by Bloom syndrome. And when you look at the Ashkenazi Jewish population, 1 in every 60,000 of these people are carriers, are affected by Bloom syndrome, and 1 in every 100 of them are carriers of Bloom syndrome. And because of this increased rate of people having Bloom syndrome, they do offer special testing for this ethnic group for Bloom syndrome. The few organizations for Bloom syndrome, there's the Bloom Syndrome Registry, which was established in 1960, which goes through and does all of the research and keeps up on Bloom syndrome. You also have your Bloom Syndrome Foundation, which was established in 2004, which goes out and raises money to put forth for research of Bloom syndrome. You also have your Human Growth Foundation, your Madrick Foundation for Children's Growth, and your March of Dimes Birth Defects Foundations, which are all, none of those are specific for Bloom syndrome. All of those, concentrate on people with growth defects, but Bloom syndrome is included in those. And right here you can see a picture. This is a young man with Bloom syndrome. He has been outside in the sun, and you can see here his butterfly rash that he has on his face, and it is on other places of his face, but it's more prominent on his nose and cheeks. And then here's another example of a child with Bloom syndrome. You can see his big ears, his big nose, and things like that. And those are just the general effects of Bloom syndrome. And that is it.